We know people in Surrey, in the main, lead a generally very healthy lifestyle. Our life expectancy is higher than that found in the southeast in England. However, why prevention is so important is that we know inequalities do exist in our county, both for life expectancy, but more importantly, for healthy life expectancy, where we've got about an 8.5-year difference in healthy life expectancy, depending on where our residents live.
One of our prevention ambitions is for people to lead healthier lives by preventing physical ill health and promoting physical well-being.
In Surrey, 50% of children and 30% of adults are not meeting Chief Medical Officer guidelines for their physical activity levels. And we know that those who have the most to gain from being active often have the least opportunity. So in partnership with both Sport England nationally, as well as a range of local partners, including health, the Borough Council, the County Council and the voluntary and community sector, alongside Active Surrey, we have formed a new PLACE partnership. The idea behind the PLACE partnership, it will help us tackle inactivity in the area of Stanwell. So we'll be looking at this in two ways. One, we'll be addressing the systemic barriers that are holding inactivity in place. And two, we want to take a bottom-up approach, really listening to local residents who are telling us what their wants and needs are and using them to create that change in the local area. So that might be things like getting more people cycling. It might be tackling bigger issues in partnership, like tackling antisocial behaviour in the local area.
Smoking is one of the biggest preventable causes of death and illness and contributes to the biggest gap in healthy life expectancy. We have increased the capacity of our free behavioural support and quit aids for our residents. We are co-producing new programmes of work to support people by listening to our residents and our workforce. And most importantly, we're raising the awareness of the support available to our residents through a new mass marketing Stop Smoking campaign.
We know that the incidence of diabetes is very high in the South Asian community, and Red Hill and Merstham have been identified as areas of risk. The need was to actually deliver the healthcare checks at the places where the uptake would be more. So we selected community hubs and then food banks and a well care centre. They all joined hands together to deliver healthcare checks at the points which are easily accessible, and then at the same time not only doing the health checks, doing the diabetes, but providing diabetes screening, but providing them with advice, lifestyle advice, and signpost them to the resources that are available. It is, of course, preventing on a bigger scale future cardiovascular complications.
We want local people to have the same opportunities to live healthy lives without disparities due to ethnicity, age, wealth, disability, or where you live. Working together with local partners and communities is vital in helping us do this.
One of the projects that we are doing with Surrey Heartlands is our Baby Steps project, which is where we are supporting ethnic minority communities in key locations in Surrey. We hold sessions in family centres where they can come in and get support for their physical health, their mental health, and connecting them with the services that are already available. And the impact of that has been huge in the sense that there's more awareness about the services that are available, plus the engagement has increased as well.
If we are working with mothers before the children are born, we're giving comfort to mothers, but then their children are going to be born in a safer environment, and that affects future generations.
Evidence tells us, but we know from our own experience in Surrey, in order to really improve health outcomes, we need to, as agencies and a partnership of agencies, we need to work alongside residents and communities. Communities know what affects their health in particular, and that action led by communities can make that real difference. So that's absolutely essential that we continue to do that and build on that as a partnership.
I think what people get the most out of coming here depends on where they are in life. I think if you're lonely and you're needing a place to connect, this is a great place to come. I think if you're in need of advice, that's here too. Community fridge, there's amazing stuff for everyone here.
The community fridge was the first thing that I come to, which was a lifesaver. And then family feast, it's free for the community. So for struggling parents, it's incredible. I meet my friends here and the kids come and we really get to, join in and just chill and eat the food together. It's lovely.
I think the community impact on anyone is really unmeasurable.
One of the ways we are co-designing local solutions is using the knowledge and expertise of our voluntary, community and social enterprise partners. The VCSE Alliance has helped the sector create a strong collective voice as equal partners.
I feel that we are hugely seen a part of Surrey Heartlands. I think there's been huge shift and change in terms of our involvement, being involved at very early stages. We had been collaborating with the Surrey Heartlands Academy to put together a code of practice for volunteers. And that's not just about charities. Volunteers are through all of the health and social care within the county. And it's really encouraging that we're going to work together to put a code of practice together for volunteering that is for the workforce of Surrey. And I think that's really exciting to see.
We know we've got a lot to do delivering our prevention agenda, but our outcomes demonstrate we are showing some signs of success.
In 2023, we launched an ambitious ICS strategy that talked about how we wanted to deliver and organise our services as a system going forward, with a focus heavily on prevention and early intervention and delivering care differently. A really good example of that is the developing integrated neighbourhood teams that are developing across the whole of Surrey Heartlands.
In my own patch in west of Waverley, for instance, we have monthly multidisciplinary meetings involving the practices, involving the social services, mental health, community nursing teams, and occasionally we get someone from the voluntary sector involved also to talk about how best to support our most vulnerable residents locally in a joined up way. Having the right relationships is key to driving any service at all, knowing the people you're dealing with, and also creating an understanding of what their challenges are. So we're not talking to one another across barriers, but we're working together to make things work for our patients, but also for the services that we represent.
Working at a local level, we're also looking at how we can best deliver care to our residents.
The paramedic home visiting service was started to help the practices meet the demands for home visits in west of Waverley primary care network. We historically had high numbers of visits requests, but we cannot go out to see that patient till about lunchtime when we've done our morning surgeries. And sometimes that causes unnecessary delays and delays in the treatment the patient needs. So we wanted a service that could respond quicker. This has helped reducing the number of unnecessary ambulance call-outs or conveyances to hospital. And in essence, an average visit will take about 40 minutes. That's 4 appointments you could have seen in the surgery. So there are quite a number of benefits to the system.
The mental health of our children, young people and adults in Surrey is a main priority for all of us. We have come together, therefore, to deliver on 5 areas of work where we believe transformation is necessary to improve the mental well-being of all of our citizens.
Our new First Steps to Support service is a free and anonymous phone line for adults, targeting neighbourhoods with the poorest health outcomes.
Recognising the need to provide more support to those who are feeling anxious and just not themselves, we set up First Steps to Support, a free and anonymous phone line where people can speak directly to one of the team's friendly wellbeing advisors to get the help they need. Different to a crisis line, this service is providing a much-needed wellbeing service to help manage growing anxieties and concerns and sign people to the right support.
As part of our strategy, we want to take advantage of the latest digital technologies and innovation to support people to live healthier lives, and that support our staff to work more efficiently, creating more time for direct patient care.
Ali is an acoustic monitoring and motion sensor. It comes in the form of a small white box that is attached to the wall just above the television in a resident's room. And then throughout the course of the night, if it hears any sound or if there's any motion that it detects that is out of the ordinary, it sends an alert to the carers' handheld devices.
Normally we have our hourly checks, but anything in between is actually covered by Ali. So this is a huge reassurance and benefit to all of us.
We're currently going through the process of implementing the technology in another 9 care homes and looking to extend it further.
We are also working collaboratively across our system to create more opportunity for our collective workforce. For example, our Health and Social Care Academy is leading the way with our innovative Level 2 Surrey Care Certificate.
The care certificate traditionally has been around for a long time. There's 15 standards of care which students are supposed to be able to exhibit. But because it's never been quality assured before, the standard has really varied.
From the quality of the work produced to the quality of the assessing, which I believe has devalued the quality of the care certificate and indeed its portability, which often means that workers have to redo the care certificate quite often.
The whole point of the programme, it was to professionalise social care and enable the beginning of a career pathway into a longer career in Surrey Heartlands.
And we are the pioneers of this project. We're the only people in the country to actually develop an accredited version.
So the Surrey Heartlands strategy, I think, is heading in the right direction because there's a strong emphasis on collaboration and forging relationships. And there is an aspect of it I'm particularly delighted about, and it's the fact that we're starting also to have conversations with colleagues in local government. I have conversations with people in our local boroughs, and this is all important in making sure the most vulnerable people in our communities are supported as much as possible.
We know there is more to do, and we look forward to working together with our citizens to continue to deliver on our strategy to keep Surrey as healthy as we can.